Welcome to phactMI's Drug Information channel. Today, let's discuss the levels of evidence pyramid. Every day in healthcare, decisions are made that impact lives. But how do we know which decisions are the best? The answer lies in evidence-based practice. And to navigate the quality of evidence, we use a vital tool known as the levels of evidence pyramid. This pyramid is a simple visual hierarchy that ranks research studies based on the rigor of their methodology and the reliability of their findings. Not all evidence is created equal. To make informed clinical decisions, we need to guide clinicians to the highest quality, least biased evidence available. Let's walk through the pyramid from bottom to top. At the base of the pyramid, we find abundant evidence, but it is generally of the lowest quality. Expert opinions are beliefs or interpretations by specialists. While valuable for hypothesis generation, it is highly susceptible to bias. Case reports and case series are detailed descriptions of one or a few patients with a unique condition or treatment outcome. They are the cornerstone of medical progress by identifying new ideas, but they lack a control group, making them unreliable for making generalized treatment decisions. Moving up, we encounter observational studies, which are more robust but still carry risks of confounding factors. Case control studies look backwards to compare exposures in those with and without a condition. Cohort studies follow two groups, one exposed to a risk factor and one unexposed over time to see who develops an outcome. A simple example is following smokers and non-smokers to see who gets lung cancer. Observational studies provide stronger evidence but cannot fully establish causation. Next are non-randomized control trials. These compare interventions, but participants aren't randomly assigned to groups. This introduces a significant risk of selection bias, which could skew the results. Now we reach a crucial level, randomized controlled trials, or RCTs. Randomized controlled trials are considered the gold standard for studying interventions. Participants are randomly assigned to either an intervention group or a control group. This randomization minimizes selection bias, allowing researchers to confidently conclude that the intervention caused the observed effect. Next is critically appraised literature. This refers to experts evaluating and summarizing individual studies, often RCTs, to help you understand their strengths and limitations. Finally, at the top, we find the highest quality evidence. These studies synthesize results from multiple RCTs. Systematic reviews are a comprehensive, methodical summary of all relevant studies on a specific question. They define a strict search strategy to minimize bias in finding studies. A meta-analysis is often the final step of a systematic review. This uses quantitative statistical methods to combine the results from multiple independent studies. This increases the overall sample size and provides the most precise estimate of an effect. Why does the hierarchy matter? The higher you go in the pyramid, the more confidence you can have in the findings. But remember, higher isn't always better for every question. For rare diseases, ethical concerns, or new treatments, lower levels of evidence may be all that's available. Regardless of the level, every study must be critically appraised using three key questions. First is validity. Was the research conducted in a sound and unbiased way? Next is impact. Are the results meaningful and statistically significant? Last is applicability. Can these findings be applied to my patient population and setting? Critical appraisal protects us from adopting practices that look promising but lack scientific rigor. In summary, the levels of evidence pyramid teaches us that not all research is created equal. From the hypothesis generating information at the bottom to the statistically rigorous meta-analysis at the top, our journey up the pyramid is a journey toward less bias and greater confidence. Using this hierarchy is foundational to practicing safe, effective, and evidence-based medicine. For more information, visit our website at www.phactMI.org.